In this video, we will discuss about fatty liver. It is also called as fatty change or steatosis of liver. Steatosis means increased buildup of fat. So it is a one type of reversible cell injury. So what is fatty change? Excess accumulation of fat or triacylglyceride in cell cytoplasm is called as fatty change. Otherwise, we can say excess accumulation of fat in cytoplasm of parenchymal cell. It is a reversible cell injury. Excess accumulation of fat in cytoplasm of parenchymal cell. Suppose we considered this is our cells in our body. This one is the cytoplasm. In this one, it containing water. Cells containing water. The cytoplasm, it have protein, fat, etc. Here, fat is normally presented in our cell. 5% only. That one is normal. Here, excessive amount of fat. Here, fat amount will increases or triacylglycerol amount will increases means it is called as fatty change. Next, fatty infiltration. What is fatty infiltration or fatty ingrowth? Accumulation of fat in between the cell is called fatty ingrowth. Accumulation of fat in between the cell is called as fatty ingrowth or fatty infiltration. Next, different type of site of fatty change. Different site of fatty changes. Most common site are liver, heart, kidney, skeletal muscles. These are the most common site to fatty change. Now we will discuss about fatty change in liver. It is also called as fatty liver. Suppose this one is hepatocytes. This one is the nucleus. It containing a certain amount of fat. 5% means normal. Here excess amount of fat is called as fatty liver. So it will affect normal functions. Causes of fatty changes of liver. What are the causes? Change fatty liver, infective hepatitis, prolonged starvation, nutritional deficiency, then diabetic mellitus, alcoholic abuse, obesity, poisoning, hypoxia, anorexia, and cardiac failure. These are the different causes of fatty changes of liver. Next, how fat deposited within the cytoplasm of hepatocytes. What is the pathogenesis mechanism of fatty liver? Excess entry of free fatty acid in hepatocytes. Second reason, decreased utilization of fatty acid by hepatocytes. First one is excessive entry of free fatty acid into hepatocytes. Each and every moment daily free fatty acid enter our hepatocytes. Some bond formation and produced energy. When excess amount enter, then deposited of fatty acid. Second one is decreased utilization. During energy production, hepatocytes utilized less energy. Here it utilized less energy. Then decreased utilization of fat. Third one is increased esterification of fatty acid to triglyceride or triacylglycerol. Fourth condition, increased endogenous fatty acid synthesis by hepatocytes. Increased endogenous fatty acid synthesis by hepatocytes. Next factors, decreased apoprotein synthesis by hepatocytes. Apoprotein is the protein. It is synthesized by hepatocytes. This apoprotein bind with the lipid and form lipoprotein. With the help of lipoprotein only, lipid transport in our body. So here decreased apoprotein synthesis also causes fatty liver. If anybody suppressed by infective hepatitis, it associated with fatty liver. How? By virus or any other causes like sick. The fatty acid not utilized proper. It causes fatty liver. So virus or any other sick condition, fatty acid not utilized proper, it causes fatty liver. Second condition, prolonged starvation, not getting glucose, fat, carbohydrate. That time patient body need energy. So subcutaneous fat move to liver to produce energy. So this time fat accumulate in liver. Second condition, prolonged starvation, not getting anything means body get energy from subcutaneous. So this time fat accumulated. So it causes fatty liver. First condition, infective hepatitis. Second one is prolonged starvation. Third important factor, nutritional deficiency. Protein energy malnutrition causes fatty liver. Next condition, diabetic mellitus. Diabetes mellitus. There is sufficient carbohydrate in the plasma. So here carbohydrate is presented, but there is insufficient metabolically available carbohydrate. Metabolically available carbohydrate is insufficient. So it causes accumulation of fat. Next one is alcoholic abuse, impaired functions of mitochondria. So here during alcoholism, impaired functions of mitochondria, fat not oxidized, so fat deposited. So the summary form of pathogenesis of fatty liver in our body through diet or adipose tissue synthesis, we had free fatty acid. This free fatty acid entered to liver. Excessive entry of free fatty acid in liver. So excess amount of entry of free fatty acid, then increased synthesis of fatty acid in liver. Here increased amount of synthesis occur in liver. Next one is decreased oxidation of fatty acid into ketone bodies. Fatty acid not converted into ketone bodies. Then decreased synthesis of apoprotein and defective excretion of lipoprotein. This lipoprotein with the help of this triglyceride or fatty acid, with the help of apoprotein only, it will converted into lipoprotein. It will transported to plasma protein. Here defective excretion of lipoprotein will causes fatty liver. So excessive entry, increased synthesis of fatty acid, decreased oxidation of fatty acid, decreased synthesis of apoprotein, defective excretion of lipoprotein. These are the main reason causes pathogenesis. Now coming to morphology of fatty liver, first one is cross examination. Naked eye examination, the liver is enlarged. Normal liver color pink, but here due to fat accumulation it become yellowish color. Normally pink, because of fat, yellow color. Then consistency soft. Second one is cross section. Suppose this one is liver, we will cut section. Normally pink color, here yellow color. Normal means that one is straight and smooth surface, but here bulging and hard surface. Now coming to histopathology slide, it reveals signet ring appearance of hepatocytes. This one is the hepatocytes. This one is the nucleus. Okay, there will be pushing of nucleus in periphery, so it look like a signet ring appearance. How it appear? This one is hepatocytes, this one is nucleus. Here large amount of fat accumulate, it push that nucleus. So it push out, so that nucleus will come here. It look like signet appearance. But this one, when we will do staining, the fat washed out like this appearance is presented. So this one is name is called signet ring appearance. Special staining, we are using Sudan 4 oil red O staining. It will give orange red color to fat. Then osmic acid, it producing black color to fat. Sudan 4 oil red O stain will give red color. Osmic acid will produce black color to fat. Suppose anyone affected from fatty liver, what are the complications? If fatty liver continuous long term, what will happen? Excess accumulation of fat, it ruptured the cell membrane. It will rupture that cell membrane. So formation of gap. So development of pseudocyst formation. This one name is called pseudocyst formation. This condition. Then fibrosis of liver. Fibrosis of liver leads to liver cirrhosis. So now coming to pseudocyst. What is pseudocyst? Inflammation of urinary bladder. So inflammation of urinary bladder, cystitis. Then gallbladder, cholecystitis. So it will causes cystitis and cholecystitis. This is all about fatty changes or fatty liver. Now we will see the notes format, statement form. Thanks for watching.